Hello everyone. Today we are going to be talking about cross-border interoperability roadmap from a standards development organization's perspective. We are lucky to have here today with us for this session Aisha Hasan, who is the head of Global IT, Office of the National Coordinator for Health IT at the US Department of Health and Human Services. Hello Aisha. We also have Chronaki, the Secretary General of the HL7 Foundation and President of the European Federation for Medical Informatics. Hello, Catherine. And finally, we have Robert Stegwee, Chair of SEN Technical Committee 251 Health Informatics. Hello, Robert. So, without further ado, thank you so much for coming here today, and let's get started. And we'll start with you, Robert.
Well, thank you very much. And I'll share my screen with you. And thanks for the invitation to be present in this interesting session. Let me say a little bit about SEN TC 251. It's a technical committee devoted to health informatics. And as the name says, we're part of SEN, one of the three recognized European standards developing organizations, which gives us a special status within Europe and a special tie to the European Commission and its works. So basically, our commitment is to support the EU member states, but also the European community in a broader sense. So we're not just limited to the European Union in their ambitions and objectives around digital health. And those ambitions are quite steep, as some of the countries in Europe are really leading the way in digital health and e-health. So that's what we do. And you might think that we actually develop our own standards for Europe. We don't. We don't want to, at least. If necessary, we will, but we prefer to produce standards at a global level. So that's why we are one of the three founding members of the Joint Initiative Council for Global Health Informatics Standardization. And that group has grown over the years to a group of 9 international standards developing organizations, of which we are the only European one and the non-global one. All the others are global. So we really want to bring our expertise and adapt and adopt the international standards of the global SD0's for implementation within Europe, tweaking it so that it fits with the objectives, the ambitions, and also with the legal requirements within Europe. So how does that work? If we look at the objectives, I take 2 as an example. One is the digital transformation of health and care. That's one of the big programs. There was a communication on this in 2018, where the European Commission actually set out the strategy for digital health and care. And one of the pillars is the access to data, and not just in general, but typically across borders. Because we have this agreement in Europe to be able to travel, and your health data should be able to travel with you. That's part of a patient rights directive that was adopted quite some time ago. And part of that sharing of data is the patient summary, a guideline that was developed by the European eHealth network. And we were asked as SEN to turn that into a standard. And that's the International Patient Summary Standard that we developed, and that kind of implements the guideline and is the basis for global standards as well, as I will come back later. So that's one of the things that we've done to support the objectives. Another one is to have citizen empowerment and have access to digital tools. And we all know the apps. But one of the problems with the apps is that people don't know whether they can trust them. And especially doctors and nurses don't know whether they can trust them and prescribe, if you want, those apps. So we're working on a quality label for health and wellness apps that's easy to read, just as easy as an energy label for a washing machine, and that tells you what you can expect from this app and whether it's good for use in your particular context. That one is currently under ballot, so everyone around the world can have their comments, and we'll process those into the final technical specification that will come out. So those are two examples of how we serve the digital transformation of health and care. Another example that's currently being set in motion is the European Health Data Space. And one of the key elements within the European Health Data Space is data quality and interoperability. And we participate in a number of projects. One is the eHealth project, where we strive to develop the specifications for an exchange format that enables not only the patient summary, but the full content of an electronic health record to be shared across borders for research purposes, but also for primary care purposes, etc. And that's quite an endeavor, but we're making good progress on that. Another project that we're participating in is the identification of medicinal products. Actually, that's an ISO standard that we contributed to from a SEN point of view as well, and was one of the first joint initiative council projects that took place. And now we're in the phase of actually implementing that across the medicines agencies in Europe, and reaching out across the world to actually have a global standard for medicine. Or medication, I should say. One of the things that we ran into with the patient summary is that it's very hard to compare the medication across borders. So we really need that, global identification. So those are the two examples that I wanted to make. I cannot go into much more detail, but I want to show you how we work together at a global level. So if you look at the International Patient Summary, it's not just one standard that SEN has developed. We've developed a standard that's in the middle, 17269, in response to the Patient Summary Guideline. Actually, at the time we did that, it was Release 2. That's being used also within HL7 for an implementation guide for either the CDA technology or the FHIR technology within HL7, having the full specification of an international patient summary that's actually implementable. And it's also being used, or it makes use of the global patient set that's been published by SNOMED International to have unique codes for everything that you want to put in a patient summary. And that global patient set is available free of charge. At the meantime, we've been working with ISO to turn the International Patient Summary into an international ISO standard, and that is aligned with the Release 3 of the European guideline that's about to be adopted, I think next month in the eHealth network. And finally, there's an IHE IPS profile that actually details the workflow around how do you use an international patient summary, how do you produce it, how do you consume it, how does that work? So that's the way we all work together. And with that, I want to hand over to Catherine for the part on HL7.
Thank you, Robert, very much. And I will take a slightly broader view here. Let me share my screen. So hello, everyone. It's been a pleasure to collaborate in cross-border interoperability roadmap efforts with SEN and IAT. And this will be the topic of what I will be explaining to you today, putting it in the broader context of collaboration along the years. And Robert already described the specific projects we are advancing together. So first of all, the Hs7 Vision is a world where everyone can access the right data when and where it's needed. And the European Office of Hs7 I'm heading was formed in 2010 and works with European affiliates, organizations independent that are established in each of the European countries to elicit the requirements for Hs7 standards. This effort that I would like to focus my brief position here is called e-standards. And as I said, it was a joint effort in 2017-18 between HL7, SEN, and IHE Europe. And the vision of this effort to develop a roadmap for large-scale development of e-health in Europe was that of a global e-health ecosystem, an ecosystem where people have navigation tools for safe and informed healthcare, and where interoperability assets fuel creativity, entrepreneurship, and innovation. In this e-health ecosystem, the standards is a new type of standards that nurture digital health innovation, that strengthen Europe's voice and impact, and enable co-creation and trusted provider-user relationships. Notably, these standards usually, as Robert said, do not come an effort, a European effort to develop a cross-border roadmap for the large-scale deployment of e-health in Europe. And here, there was a joint vision between HL7, SEN, and IHE and other organizations to develop the vision of the global e-health ecosystem where people have navigation tools for safe and informed healthcare, and interoperability assets fuel creativity, entrepreneurship, and innovation. In these global e-health ecosystems, we have different standards, a different age of standards. We call them e-standards. Standards that do not come necessarily from one organization. They are collaboratively developed and nurture digital health innovation, strengthen Europe's voice and impact, and enable co-creation and trusted provider-user relationship. So what was the focus of this roadmap? The focus of the roadmap was data. We recognized that most of the systems around us were systems of record, like silo electronic health record systems, which were mostly focusing on the documentation, but not reuse, not eliciting knowledge from this documentation of information. And even if we look to the cross-border initiatives for patient summaries and prescriptions, they were at the macro level. They didn't look at the needs of communities and individuals as much as they could. So what we recognized is that we need to embrace change and we need to embrace flexible governance. And this can happen by moving from systems of record, documentation systems, and systems of differentiation, profile-based exchange of data, to systems of innovation, which unlock data and focus on user experience. So this is in a nutshell the roadmap that we developed. At the center, you see trust and flow, the core principle to build and nurture and maintain trust in the data and facilitate dynamic flow of data. We start from the left, what we call this left sign, we call it the standards compass. And this is about identification of needs, taking the perspective of different stakeholders into account, citizens, the health system, the market, the workforce. In the middle, we see the iterative process, and this is about the e-health components that have been already developed, and we need to gradually, iteratively improve. And how do we do that? We do that through co-creation, governance, and alignment, engaging actors that are not traditionally there, focusing on flexible governance, and continually aligning. So in a nutshell, the key points of the standards roadmap were trust and flow, the basis of well-functioning health systems. The standards compass, respect the perspective of stakeholders, and the standards roadmap components, which are about reuse of existing technology. But most importantly, the notion of co-creation and governance and alignment as concentric cycles that bring these activities together. The concrete recommendations were to identify keystone projects at the grassroots level within member states. And in Europe, this project is the electronic health record exchange format supported by the ehealth project, which Portugal is actually coordinating today with SPMS. The support of these keystone projects should be done through a network of expertise, and we are focusing on developing such communities of practice. Then outreach and investment should be on education and capacity building, and we see that again happening through types of communities of practice. and also very much in Hs7 with the fire chat. And then finally, develop a platform. We didn't get there, but we do see a number of platforms that are interrelated, linked to European initiatives like ehealth, like TEDAS, like Unicom, like the eHealth Hub. And these involve standards organizations, global standards organizations, and European standards organizations. A few things about the electronic health record exchange format, that it focuses on labs, diagnostic imaging, discharge reports, and patient summaries, and it links very much to the European health data space. SEN, Hs7, IHE are part of that. And the important change from when we were developing, and actually we were right on the spot with the roadmap, was that we need to focus on the patient, on the engagement are key points. Here is again a slide about reuse of different components of the patient summary. And finally, I would like to leave you with this notion of co-creation, governance, and alignment, and the importance of engaging the different actors, policymakers, patients, deployers, SD0's, clinicians, and supporting communities of practice, and also products and services that facilitate the integration of clinical guidelines, functional models, educational materials into products. Thank you very much. Back to Aisha for the next step.
Thank you so much, Catherine. I will go ahead and share my screen. All right. And thank you, Filipe, for the introduction and for helping to put on such an excellent summit. So I'm going to very briefly discuss my office and the work we do to advance global health IT. And I'll spend the majority of my time discussing the work we're doing through the Global Digital Health Partnership. So my office, the United States Office of the National Coordinator for Health IT, referred to as ONC, is under the United States Department of Health and Human Services. We were created in 2009 and really focus on leading the US's efforts on advancing digital health, as well as ensuring electronic exchange of health information. We focus both on domestic and international efforts to advance digital health. So I lead our ONC's global health IT efforts. My team and I seek to advance digital health through the United States' involvement in global efforts, as well as through efforts we lead on the international stage. We seek to have patients' health data move with them whenever and wherever they need access to it, including cross borders. We think projects such as having a common set of health data standards to galvanize digital health interoperability are imperative to making dynamic changes within the cross-border interoperability arena. And there are many levels of interoperability that we see. For example, there is health system to health system within a specific country. There's also the local infrastructure of a nation aligning with the local infrastructure of another nation. And finally, there's also local infrastructure of a nation aligning with global infrastructure. And we strongly believe that nations should be able to collectively bolster their own interoperability levels, as well as globally through common tools and efforts. That's why we work with an array of different stakeholders at the US federal level, the global country level, and much more. So our work spans for global partners such as the United Nations, the World Health Organization, the Group of 7, the Group of 20, the European Commission, the Global Digital Health Partnership, and many standards development organizations and more. And we work with countries and territories through multinational organizations, as well as through bilateral, multilateral efforts, engagements, and agreements. I've included a few examples of our work efforts on the screen. We work with countries and territories at all levels of the interoperability spectrum. Those nations who are advanced in their digital health efforts, as well as those nations who are just starting out on developing and implementing digital health efforts. Our office also serves as a subject matter expert resource for other nations implementing digital health efforts that we have already done in the United States, and for organizations who want to learn more about the US's digital health efforts and our global partnership work. Similarly, through our work efforts, we also learn from other nations who are implementing digital health projects that we in the United States could benefit for our digital health infrastructure. One of our bigger projects is helping to lead the Global Digital Health Partnership, the GDHP. And the GDHP is a collaboration of 31 governments and territories, government agencies, and the World Health Organization, formed to support the effective implementation of digital health services. There are currently 3 observer entities who are watching GDHP efforts and are not yet formal members. It's Nigeria, Seychelles, and the OECD. Established in 2018, the GDHP is the only existing global government-to-government health IT collaboration. India is the current chair of the partnership, and the United States serves as the current vice chair. Together, we lead the partnership's efforts in a variety of work streams to ensure that we can collectively advance digital health in manners that align with all of our respective nations. So there are 5 different work streams within the GDHP. That's interoperability, clinical and consumer engagement, policy environments, evidence and evaluation, and cybersecurity. Each work stream developed a baseline white paper in 2019 to describe the GDHP members' progress in the work stream's respective areas. And then in 2020, each work stream published another white paper that built upon the first white paper and provided an update on the GDHP members' efforts in the respective areas, as well as discussed efforts the work streams could work on together to advance digital health. Each work stream is working on 1 or more projects currently, which I've included on the screen. And the United States chairs the GDHP interoperability workstream, where we've led a lot of different efforts to advance interoperability. The first white paper described the interoperability landscape of GDHP members and the health data standards that GDHP members use. The second white paper built upon the first white paper and describes barriers to, drivers of, and purposes for interoperability. And it highlights next steps and potential use cases for interoperability. And within this white paper, we asked GDHP members to let us know what projects we can work on together to advance digital health interoperability. They noted we should work on a Global Master Standards Guide, GMSG, and Global Interoperability Measurement Model, GIM, GIMM. I'll talk about these efforts momentarily. Both white papers are available on the ONC website as well as the GDHP website for your review. We developed the Health Data Standards Crosswalk using feedback from 22 GDHP nations on their interoperability efforts and the health data standards they use. While we understand the extent of usage of the full set of health data standards is much more complex and nuanced than what is reflected, this crosswalk does allow us to make initial high-level comparisons about areas of common health data standards use. Most GDHP nations support the International Statistical Classification of Diseases and Related Health Problems, ICD, SNOMED CT, DICOM, IHE, LOINC, and Hl7. As well as we found that FHIR is the key to several interoperability solutions of GDHP members' work. Now, the Global Interoperability Maturity Model, Measurement Model, the GIM, originated from the feedback that we heard from GDHP members in the second interoperability workstream white paper. The GDHP members indicated they think a GIM would be an effort that would dynamically impact the interoperability space by being able to demonstrate the interoperability adoption level of GDHP nations. It would serve as a blend between policy and standards and data. It followed a multi-stage model and could be further expanded to include countries and territories not in the GDHP. The GDHP interoperability workstream studied many interoperability measurement models to develop the GIM. And after many discussions in our GDHP meetings, we've agreed to work with a partner organization to ensure alignment for the GIM on the global stage. The GIM is still in very early stages of development now, and there will definitely be more information to come about the model soon. Similarly, the Global Master Standards Guide, what we refer to as the GMSG, also originated from the feedback we heard from the GDHP members in the second interoperability workstream white paper. The GMSG would identify, assess, and describe the recognized specific health data standards for GDHP countries and territories to use to fulfill their interoperability needs. And while there is overall alignment on baseline standards that are discussed during a lot of our global digital health meetings within the GDHP and elsewhere, there is a need for consistent and detailed guidance on those baseline standards and their implementation. The guidance would increase alignment between participating GDHP countries and territories on the standards being advanced globally. And we think that the GMSG could be a GDHP supported global best in use standards guide for countries at all stages of adoption, implementation, and interoperability. And it would really incorporate methodology to score members to analyze the level of interoperability within their nations. It would focus on GDHP members first, and then be further expanded to include countries and territories not in the GDHP. Similar to the GIM, we're still in early stages of the GMSG development, And we're focusing on the first batch of use cases for the guide. Now, we've heard from GDHP members on the interest of including public health as a use case, given the COVID-19 pandemic and other potential future pandemics. So there's more to come on the GMSG as we continue to advance this effort. And the last project that I'll talk about that the GDHP interoperability workstream is advancing is the International Patient Summary, IPS. Robert and Catherine discussed the IPS, so I won't go into much detail about the standard itself, but instead I'll focus on what the GDHP interoperability workstream is doing to advance the standard. And when we think of the use case of patients' health data following them whenever and wherever they want it, including across national borders, we can note the IPS as a prime example of that. The IPS is an EHR extract with essential patient data that providers in a nation the patient is visiting can use to provide personalized care to the patient. It's particularly helpful in times when the patient arrives for unscheduled care. And the GDHP interoperability workstream formed an IPS workgroup, which is leading efforts to advance the standard among GDHP nations with the overall goal of having all GDHP members implementing the IPS, and then of course, reaching beyond to non-GDHP countries and territories as well. The workgroup meets bi-weekly and has meetings to discuss how to advance the standard, address any obstacles nations may have while implementing the standard, identify how to align local, country, and territory health IT infrastructure with that of the IPS, and much more. We're also holding mini connectathons for testing. And as folks know, the value sets are based on vocabularies that are understandable in any nation. And the focus really is on the data elements that are most important for personalized care. The data elements within the IPS composition really help advance that cross-border care through health data standards. And of particular importance now during the COVID-19 pandemic are immunizations and diagnostic results. Having a patient's immunization and diagnostic results status could really help expedite a patient's ability to join and cross into another nation when presenting at the border. And there have been multiple discussions within the GDHP and elsewhere about the immunizations and diagnostic results being moved from recommended to required. And I'll end with this slide where I just note that there are currently 17 nations and the World Health Organization, G7, and also the World Health Organization Smart Vaccination Certificate leads participating in this work group. We invited the G7 and the WHO Smart Vaccination Certificate leads to join our workstream efforts, so there's alignment among global IPS efforts of multinational organizations. And within the work group thus far, we have identified use cases for the work group, such as document bundle for cross-border data exchange, transfer of care, and IPS profiles being used as a foundation for other specialized specifications. We've also discussed steps for GDHP members implementing IPS, and we've talked about the work group's goals, milestones, success with implementing the IPS, medical terminology, maturity implications, and we've had a robust discussion on policy, legal, and cybersecurity implications for the standard. And it's very important to highlight that the group is determining the most efficacious manner to advance IPS for all types of nations. So those include nations with advanced digital health infrastructure, as well as those nations who are in the earlier stages of implementing digital health within their borders. And of importance is the discussion of aligning IPS efforts with local national infrastructures so that there are no issues with the data exchange when we talk about that cross-border interoperability. And the group wants GDHP nations to be able to implement the IPS and also to expand to non-GDHP members. So I'll stop there with just a plug to say that if your nation is not one of the nations involved in the GDHP and you are interested in advancing digital health in this manner through the GDHP workstreams, and particularly for our discussion here today, interoperability, please feel free to reach out to me and we can figure out how to move forward.
Thank you, Aisha. Thank you, everyone. So I think that we still have 5 minutes for questions. So this is going to have to be quick. But as you were going through your presentations, there were 2 words that really stuck out for me. So one of them was trust. The other one was collaboration. So I think that these 2 words are fundamental for what we have already achieved with interoperability, as is the case of the International Patient Summary. But this also brings up an interesting idea that Aisha briefly mentioned at the final slide, which is, so traditionally you have been interoperating systems by managing the collaboration and trust from one server to another. But now, with the COVID pandemic, you have started to see some penetration of other standards that are not traditionally used in health to leverage the standards that we already have in place to, I will say, jumpstart interoperability, to really enable us to achieve interoperability fast without relying on the server-to-server connection. And so my question is, should you strive to develop data standards or efficient exchange mechanisms? So, and this is for all of you.
Well, maybe I can take a first shot at that. I think we're seeing now, especially with some of the developments around the COVID pandemic and the certificates that people want to carry around in their phone, that we really need a different model, and we really need to make sure that what's on that phone can be read anywhere without a very complicated infrastructure. So we're really at the point of the patient or of the citizen, we're really looking into standardizing data. And that has huge consequences for the systems behind the scenes that either have to translate to become interoperable or also have to adopt that same data standard. And it's much easier for countries that haven't a huge legacy of systems that are proprietary, that have their own local standards. I mean, a number of hospitals have just invested so much in their own system that it really fits all their needs, but it cannot adhere to any of the data standards that are out there. So you have to translate into connection, and reinvesting in such systems is very costly. But we saw this also some years ago when Estonia became part of the European Union. They had virtually no digital infrastructure for health, and they were able to speed up to the top of the European countries in virtually no time because they didn't have that legacy. So yes, in countries where you still have the chance to invest in data standards, please do, because that is really the future, especially given that I want to walk around with my medical record on my phone, or my patient summary, or my vaccination certificate, and it needs to be readable wherever I am.
And I would just add on, Filipe, to what Robert said. I agree with all of his points. Those are excellent points. And I would even go a little bit broader and just say that, you know, it's definitely very important to work internationally on mechanisms to have patients' health data flow with them wherever they go. Like Robert said, I would like to have my data on my phone, regardless of if I'm in the United States or in cross-border travel. And I think that it's very important, you know, to be able to think ahead. So of course, with the COVID-19 pandemic, you know, it's something that we need response on, and we need to work together on now. And I would also take a step back and just say, in the broader realm of digital health interoperability, projects like the Global Master Standards Guide that I had referenced, I think with similar health data standards will make it easier for patients' health data to flow. And also not only to flow, but so that the providers can provide more personalized care for the patient. And I think that among, you know, from moving country to country, it will be a helpful use case as well as others. And similarly with the IPS, I think, you know, there are these existing standards for cross-border care. And I think that to Robert's point, you know, it's very important to be having conversations with countries and territories who are at all levels of digital health interoperability. There are those that are very advanced and those who are just starting off, and just making sure that we are all working towards similar health data standards so that the patient's data can really flow. So whether it's the day-to-day routine or if there's instances such as pandemics when things like immunizations and lab results are really vital, necessary pieces of information that multiple entities need to know about.
Yes, and if I may add, I think the elephant in the room is also AI and algorithms. And we need data standards to actually drive better algorithms and results that we can trust. So I think to the point of Aisha and Robert, exchange infrastructures are pretty much mature. They don't need to be healthcare specific. There is adequate work there across borders, in borders. Some countries are more mature than others, but that's the point, learning from each other. But that's much broader than e-health, and e-health is no longer about healthcare institutions. We need to focus on the data, have high quality data, have data we trust, because if we trust the data, we will be easier in the move to AI. Thank you.
So thank you, everyone. We are on time right now. So unfortunately, we have to call it a day. Thank you so much for being here with us today, and see you next time. Thank you so much.
Thank you, Filipe.